Grafting refers to a surgical procedure to move tissue from one side to another on the body or from another creature without bringing its own blood supply with it. Instead, a new blood supply grows in after it is placed. A similar technique where tissue is transferred with the blood supply intact is called a flap. However, a graft is just a skin without a blood supply, whereas a flap is transferred with its blood supply intact. With a flap, larger amounts of tissue can be used, including muscle if required. The most common grafting manipulation is skin grafting. It is most often used to treat skin loss due to a wound, burn, infection, or surgery. In the case of damaged skin, it is removed and new skin is grafted in its place. Skin grafting can reduce the course of treatment and hospitalization needed and can also improve function and appearance. Though many tissues can be grafted, such as bone grafting, it's used in dental implants as well as other instances. The bone may be autologous, meaning that it is derived from the same individual, and it's typically harvested from the iliac crest of the pelvis. Next will be fat graft, and is the process of harvesting adipose tissue through liposuction, processing, centrifugation, and injection into soft tissue for improving coverage, volume, and contour, typically in the breast, buttock, and face. Ligament grafting repair, as with anterior cruciate ligament reconstruction or ulnar collateral ligament reconstruction. The procedure is common among collegiate and professional athletes in several sports, particularly in baseball. And the final one would be vascular grafting. Now, what are vascular grafts used for? Vascular grafting is most commonly done to bypass a complete or partial blockage in an artery in order to improve blood flow to the organ supplied by a diseased artery. It's commonly performed due to inadequate blood flow, which is called ischemia, caused by atherosclerosis as a part of organ transplantation or for vascular access in hemodialysis. In general, someone's own vein is the preferred graft material for a vascular bypass. It can also be called a conduit. But other types of grafts, such as polytetrafluoroethylene, polyethylene terephthalate, or a different person's vein, which is an allograft, are also commonly used. Arteries can also serve as vascular grafts. A surgeon suits the graft to the source and targets vessels by hand using a surgical suture, creating surgical anastomosis. Common bypasses sites include the heart, where coronary artery bypass surgery is performed to treat coronary artery diseases, where lower extremity bypass surgery is used to treat peripheral vascular disease. The indications for coronary artery bypass grafting are such: over 50% left main coronary artery stenosis, over 70% stenosis of the proximal left anterior descending and proximal circumflex arteries, 3 vessel disease in asymptomatic patients or those with mild or stable angina, 3 vessel disease with proximal LAD stenosis in patients with poor left ventricular function, 1 or 2 vessel disease in a large area of viable myocardium in high-risk area in patients with stable angina, over 70% proximal LAD stenosis with either an ejection fraction below 50% or demonstrable ischemia. Contraindications. CABG is not considered appropriate in asymptomatic patients who are at low risk of myocardial infarction or death. Patients who will experience little benefit from coronary revascularization are also excluded. Although advanced age is not a contraindications, CABG should be carefully considered in the elderly, especially those older than 85 years, since these patients are also more likely to experience perioperative complications after coronary artery bypass grafting. Premedication. The aim of it is to minimize myocardial oxygen demands by reducing heart rate and systemic arterial pressure, and to improve myocardial blood flow with vasodilators. Drugs that should be used up to the time of surgery are beta blockers, aspirin, calcium channel blockers, and nitrates. Administered agents are as follows: Tamizepam immediately preoperatively, or midazolam, a small IV dose in the operating room before arterial line insertion. Anaesthesia. Cardiac surgery is most commonly performed under deep general endotracheal anesthesia. Technique. Sites from which the conduit can be housed include the following: saphenous vein, the left internal thoracic artery, radial artery, right internal thoracic artery, right gastroepiploic artery, inferior epigastric artery, the short saphenous vein, or the cephalic vein and upper extremity vein. After the patient has been put under anesthesia, you can begin the artercoronary bypass. First of all, the surgeon will have to perform a median sternotomy. Afterwards, they also split your breastbone or sternum down the middle, then spread and lift your ribcage to make it easier to access your heart. Once they reach your heart, the surgeon will take the harvested blood vessel. The surgeon will perform an autograft intake from the vessels I have mentioned before. Of course, after the vessels have been harvested, the patient is given heparin to inhibit blood clotting. After that is done, it will be wise to connect a medical blood circulation apparatus to the heart. If the patient is placed on the heart-lung bypass machine, the heart will be temporarily stopped during the surgery so the surgeon can perform surgery on the coronary arteries. The heart-lung bypass machine does the work of your heart and lungs so that all the parts of the patient's body still receive oxygen-rich blood that they need to survive. One end of each vein graft is sewn onto the coronary arteries beyond the obstruction, and the other end is attached to the aorta or one of its branches. For the internal thoracic artery, the artery is severed and the proximal intact artery is sewn to the LAD beyond the obstruction. Once the grafts are completed distally and proximally, the patient is warmed to a normal temperature and the heart and other pressures are normal to support coming out the bypass machine. Weaning out the bypass machine begins. Protamine is given to reverse the effects of heparin. Chest tubes are placed in the mediastinal and pleural space to drain blood from around the heart and lungs. The sternum is wired together and the incisions are sutured closed. The patient is moved to an intensive care unit to recover. Nurses in the ICU should monitor blood pressure, urine output, respiratory studies, and other characteristics of the patient. Of course, some complications may arise after the surgery, such as the blood clots causing heart attacks, stroke or lung problems, infections, pneumonia, breathing problems, pancreatitis, or kidney failure.